existence should be as low as possible. That would be my approach. But to do that, I need to start looking at welfare budgets and healthcare budgets and things like this, because almost 40% of public spending is health and welfare. So you can't go trying to encourage this gentleman to sort of to be successful in business, create wealth, create employment, and everything else, if government is saddled with responsibilities that it can't afford. And this is the challenge. And I'm not suggesting for 1 second that it's an easy situation, because it's not, because you do get people who inadvertently are casualties. And it sounds like you are a casualty of the policy.
I wouldn't mind. I mean, you were just saying about like capital tax and whatever else. I mean, like just for today, for example, Goldman Sachs, HMRC, £20 million, they let them off. So Gideon didn't look embarrassed. Well, that's £20 million that could have come back in. If they're going to chase somebody who's disabled and have them so they literally want to kill themselves, then they can chase a big corporation to get the billions they own and stop picking on the disabled.
And I agree with you, madam. I know you'll be surprised that I would agree with you, but I do fundamentally agree with you, which is why I wasn't in favour of bailing out the banks, because it was not in the interests of the great majority of the public. And I strongly believe that, and it leads to this morally just indefensible position where tax authorities and government agencies in general go after the small man, not the big man. Because going after the big man is extremely difficult because they move their money around in a way so that they avoid levels of taxation. But the response to that isn't necessarily to beat them up, it's to be clever about how you administer that taxation. So, for example, Starbucks famously avoided corporation tax. So if you enjoy your Starbucks, you've been encouraging a company that did avoid its corporation tax. If, on the other hand, we scrap corporation tax and put up business rates or employee taxation for the company, not the employees, so the employers' taxation of the employees, they're immovable. They can't do anything about those. If they're going to have a Starbucks in Bracknell, they have to pay tax on their employees and they have to pay tax on the property. Because the property exists. Corporation tax, what they do is they create a company in another country and they pay management services. And the money just goes over here and you don't pay tax.
So when are you actually going to introduce
They are trying to do this. Now, the problem with corporation tax is the international agreements, which comes back to the discussion about Europe and about trying to have cross-border arrangements with regards to taxation. And the Chancellor is actually making some progress on this, on trying to get countries to all buy into this need for tax evasion, to be stamped out corporate tax evasion. My own response to it is that if you reduce corporation tax, then they're not going to try to avoid it. You've got rid of it. That would be my response, but I'm not the Chancellor. I hope I've given you some sort of answer. I don't think I'll give you a 100% answer, but I've tried.
Hi, Phillip. Good evening. I was wondering if you could tell us or clarify the government's plan for the NHS and how it would affect us locally.
Okay. Two aspects to that question. One, the government's changes that were voted through 18 months ago, which was an example I had of me voting for something which I wasn't 100% supportive of. Okay, I'll be honest about it. There were aspects of the bill that I supported, but there were some elements of it that I was unsure about. But these are the decisions you have to make. Sometimes you have to sort of compromise, and that's not always easy. But the concept of it is that GP surgeries form a commissioning group, which has happened around here, spread in Alaska, and they commission services from hospitals and other agencies. I think that the concept of that is very good. The reason I think that, having worked in about 50 GP surgeries out the Thames Valley, it's remarkable how different they all are. You can travel 2 miles and the population changes quite markedly in bucks and miles. You go to some parts of Reading and parts of Slough, High Wycombe, Aylesbury, Bracknell, and then you go to sort of Neath, Crowthorne, Holly Pools. or wherever. The changes are quite significant. So I quite like the idea of locally sensitive GPs going, right, we're going to commission services for our population. So that's the concept of it. The difficulty, I think, that the public are going to encounter over the next 5 to 10 years is at the same time as the coalition government put this policy in, a reconfiguration of services was already started. It was already happening. It already started actually under the previous government. So this isn't actually a party political point. It's, the previous government did double spending on the NHS. There was no question they doubled the spending. But you would have noticed locally that Heatherwood Hospital, for example, diminished its services despite the doubling of the money. Okay, so it's not about money, is my point. What was happening, and is continuing to happen, is that the number of hospitals, as in proper hospitals, the sort of emergency departments, the stuff you go to when you have a road accident, heart attack, stroke, the number of those hospitals is going to reduce in the future. You're going to have fewer big hospitals, proper hospitals, but you're going to have more community services. So you're going to, if, for instance, if a GP surgery comes to Jennett's Park, it wouldn't just be doing GP appointments in the future, it would also be doing consultant appointments, physiotherapy. Because services are moving away from hospitals into the community. But acute services, the really serious stuff when you're properly unwell, there are going to be fewer of those sites. And so the difficulty is that I think people are going to associate the reconfiguration of services with the bill that was passed in 2011. And I don't think that's necessarily fair. To a certain extent, commissioning will drive changes, because if you're buying services, that institution is going to get that money. But it was going to happen anyway. So because I knew this, because it's my sort of area of expertise, I guess, in healthcare, that's why I came out and said that I thought we should have a new hospital. That's why I said that we needed to consolidate 2 hospitals onto one site on the M4. It wasn't because, the easy thing for me to do would be to say, right, I want a hospital in Central Bracknell. I'd have been laughed out of town because everyone would have thought that I was being party political. I was just doing it for myself. I thought if you were going to have a hospital to serve 600,000 people, which is the population size you need for a proper hospital in the future, well, there's only 110,000 people in Bracknell Forest. So it's essentially 7 constituencies per hospital. So the idea that, you can't have a constituency per hospital per town, it's just not going to be like that. Sorry, it's just the way that it's changed. And so I thought we had to go on a motorway because more people could get to it, and ambulances could use the hard shoulder if there was traffic problems and all this sort of stuff. And so I sort of anticipated it, Michael, in this area before actually I was selected as the candidate. I did an interview, it's on YouTube if you want to waste 5 minutes of your life, you can listen to it. And I actually anticipate it and say, look, this is where we're going, we need to decide to do it. And I can foresee a future where Royal Berkshire is closed, Wexham is closed, maybe even Frimley Park is closed, and there's just one hospital serving those 3 areas. Now, I can't tell you where. Going back to the same old line, I'm not responsible for deciding where. But what I have been responsible for, because I've taken responsibility, because nobody else was doing this, because there wasn't an agency doing this, is that I've actually stimulated debate. I've said, look, we know this is going to happen. The medical profession knows it, the hospital managers know it. Can we decide that we're going to do it? Can we choose a location that is sensible, which is not Heatherwood? That would be a ludicrous location for a hospital. Single-lane carriageways opposite the Royal Ascot, so every time there's a race on an Ascot, you can't go into the hospital, etc., etc., etc. It has to be in a proper location. Let's decide and let's get on with it. The problem is that it's vested interests, it's people's understandably emotional associations with hospitals that they've been sick in or their children were born in or whatever it is. And it's very difficult. But I think in my lifetime, political lifetime, on the presumption that I get elected again, it's going to happen. And so what I'm trying to do for my constituents is steer it so the location is as close to Bracknell as is possible. But if I went and said it's got to be downtown Bracknell, I wouldn't have got anywhere, because it wouldn't be the right location. I think it should be on the M4. I plopped to junction 8-9 because I was trying to bring in South Bucks as a population group. It could be junction 10, it could be anywhere. But I'm pushing for it to be on the M4 as close to here as possible. And if we do get it, it's better care. Please take home the message. It means that you will get the very best care. Better care than you're getting now. More appropriate care in appropriate locations. Do you know one of the theatres at Heatherwood is from the Falklands War? They picked up a container and they come to the Heatherwood. Okay? You go outside because you need the wall to go to theatre. This is just not on. Okay, so I'm trying to, but it's difficult because some people try to make it pass for the school and they tell me, oh, you're going to defend Heatherwood and everything else. I will defend Heatherwood. If they don't build the hospital, I'll defend Heatherwood. Okay, but if they promise me the building of the hospital, then I'm prepared to see Heatherwood become a load of flats overlooking the rest of us. That's my position.
Because along with the hospital, you're saying sort of like M4, Junction 8-9, but you're also going to sort of promote and also fight for like the transport links to get there.
Yes.
That includes buses, that includes motorway, that includes cars.
And helicopters.
Yeah, because as it stands at the moment, with the Royal Berkshire, there is leeway if you need to get an ambulance up there, if there's been a crash or something. If a motorway is jammed, you're stuffed basically, and same as if people need to get there by buses.
Sure. The beauty of motorways is there is a hard shoulder. At the moment, every single hospital in this area is on a main road, okay? And there's no hard shoulder. Okay, so the beauty of motorways, you still can get through with a blue light. And ultimately, the key thing is the time from when you have the problem, heart attack, stroke, car accident, the time from there to being in the casualty department matters hugely. At the moment, where you're standing is supposed to technically get a Wexham. So contractually, it used to be Bracknell's covered by Wexham. I worked as a GP in Bracknell. It was like, I mean, there's like 4 different forms of different hospitals going. Bracknell has always been shortchanged. It's always been squeezed with its healthcare services. And again, going back to the situation you've got with the shop here, when Bracknell was nominated as a new town, they were promised the hospital. Okay, so Bracknell was supposed to have a hospital. So I knew this. I came in knowing that this legacy of people being lied to, essentially misled, and the hospital never occurred. But time has moved on, and we now need more community hospitals, more community facilities. Great majority of healthcare in this country is for chronic problems. It's not for acute problems. But if you're sick, if you're properly sick, you don't want to go to an understaffed, poorly equipped district general hospital. DGHs are history.
So Brian's Bridge still be kept open?
Yeah. That's part of the plan. Yeah, the part of the plan is to put all the community centres on one side, which is why I've supported the move to the minor injuries unit from Heatherwood to Grants Bridge. Because it makes more sense. I mean, ideally, I think Grants Bridge would be more downtown, but it is where it is, and we've got to work with that. But I don't think you can sustain both Heatherwood and Grants Bridge. In fact, Grants Bridge, the second floor is empty because Royal Berkshire can't afford to get it out, just empty. So there are signs in the system that things are consolidating because of realities beginning to go down. And it comes back to what I said at the start about healthcare and funding and everything else. The last government doubled it, okay? So we're now spending £110 billion a year on National Health Service. And this is before the baby boomer generation hit the 70s and 80s. And trust me, when that lot hit those, when they hit that down, they're going to become, through no fault of their own other than the fact that they've got old, they're going to become a significant burden on the health service. And I don't think the health service is going to withstand it. So it's in our best interest to put in infrastructure that is sustainable for the future. We don't have it. We really truly don't have it. So that's why I've got stuck here and trying to persuade people. Must be another question. No more questions?
Because that's another thing, while you're on the subject. While I'm here, it's once again, it goes back to, if people are going to have, as it stands at the moment, elderly people, when they get older, sometimes they need care. Yeah. as it stands at the moment, we know the cost of care homes and everything and what the plans are, etc. But the chance of managing their own homes and having an overnight carer, they're going to be gone because of bedroom tax. There won't be that room. So what are you going to do with those older people?
There's been a recognition of additional room space for caring, I think, in the policy because of that. But the broader challenge is that dementia is doubling in the next 10 years. Okay? That's a profound challenge in itself.
Yeah.
Diabetes is going to be 25% of the NHS budget by 2025.
Yeah.
One condition, 25% of the budget. Depression is doing this. At the same time, life expectancy continues to climb, which is fundamentally a good thing, but you're going to have families that more than one generation are going to be dependent. There's going to be sort of 70-year-olds and 90-year-olds, and there's also going to be young children. And we're not ready for this, okay? And it's going to cause some real questions to be asked about the value of family, the value of community. I'll give you an example. In Sandhurst, when I did my Q&A down there, a chap in the audience put his hand up, and they'd already been talking about this in the community, and they wanted to buy a building between them and each have access to a bed for an elderly member of their family. They had realised that the state wasn't going to be able to afford to do it. So they were trying to think, right, well, what can we do? We need to start downsizing, investing our money into properties that then we can be looked after when we're in our 80s, 90s and beyond. And it was the most remarkable question. I sort of stood there and I thought, wow. It was one of those times when I thought, that really is quite a striking point to make. They've actually thought, right, okay, we can see the future and not happening. We need to do something about this. And I've actually passed it on. It's now being carried out in the government. So they're now thinking, well, how can we make this more tax advantageous, and how can we get people to invest in these things so that we're taking the responsibility themselves as individuals, as families, as communities. And I thought it was fantastic that somebody said that. Now I recognise not everybody's going to be in a position to ever do that. But more and more people do need to do that. Because we don't, we just sort of kick the can down the road again, if I'm honest about carers who don't want long-term care. We've sort of fudged it a bit. We're desperately trying not to deal with the reality, which is basically we're all going to have to take more responsibility for our families and make plans accordingly. Which probably means that we're going to have smaller homes at certain points in our lives, but we're probably not going to have as much. We're going to have to put more money aside for our own social care and healthcare needs in the future. All unpalatable stuff for a politician to be saying, because what people mainly want is they just want it. They don't want to worry about it because they've had this cradle-to-grave welfare state instituted post-war stoic generation. And I'm sorry, it's just I can't see it adding up at the moment with an aging society. And the number of people in work in relation to people who are old is diminishing. It used to be, it was a pyramid.
Yeah.
So now doing this, there's actually a little bubble going through of people 40, 45 and 55.
So I agree with you about
And so
putting
it's
money
really,
away.
it's all very, very different stuff.
So really then you'd be in favour, instead of a minimum wage, you'd be in favour of a living wage then, to encourage people to be able to put money away then?
No, because I don't think that the state should intervene in the market. Philosophically, there are certain areas where me, low tax, small state, right-wing Tory, thinks markets don't deliver. And perversely, the last Labour government kind of introduced a market in hospital care, which I thought was totally nuts, because ultimately, if you have a heart attack, you're not going to have a choice of hospital to go to. So by definition, how can you have a market? So there are some things where markets shouldn't be applied, and I think acute healthcare is one. The energy market, and I'm sure a lot of you are worrying about your energy bills at the moment, is another another area where there isn't really. It's a very complicated area, energy, but I'm on the select committee, so I can't bore you about it if you really want me to. It's another area where markets don't always deliver what we need. But in general terms, I don't think the state should be intervening in wages. Wage controls and things like this is the road to ruin. We did this in the 70s. But my point is that I want a country that's got industry, successful businesses that are globally competitive, so more money flows into our country than flows out, in essence, right? So that we all have a standard of living. My challenge to everybody, not just you, everybody is in the future, when you're doing your budgets, you've got your £100 to spend, it's a hypothetical scenario, a proportion of that £100 you should be saving for your long-term care. But it means you probably might not go to Magaluf that year. And it's not a great message politically, trust me. Because actually what people want to hear is jam today, jam tomorrow, jam forever. But actually, in the future, individuals are going to have to save, not to buy the house, not to go on holiday. They're going to actually have to save to care for themselves and their families in old age. And that is particularly challenging, and there's a final thing I'll say on this, for the generation who are currently in work. And I don't want to beat up on anybody who's retired, I'm sure everybody's retired, but actually, the retirement, people in retirement, or certainly people just going into retirement, have had it really good. Not individual, but as a generation, have had it really good. Not had war, they've had a welfare state, they've had a health service, they have free tuition at universities, those who went. It's been broadly pretty benign times. There's been ups and downs, the 70s weren't great, but generally speaking, they've had a pretty good year. Golden generation, I would suggest. The generation since, particularly those of us who are sort of 45 and less, are getting rather shafted. Because not only